I'm Dr. David. I'm a neurosurgeon specialized in pain treatment. Today's topic is how to fix a pinched nerve in neck causing arm pain or rhomboid pain. As cell phones become popular around the globe, most commuters using mobile phones look like this, and this lifestyle deteriorate posterior neck. So you would listen carefully to this video for your long-term life. You probably have seen this kind of image on Google or acupuncture center, and this represents myofascial pain. It means that X mark, which is called trigger pain, can cause pain that distribute along small red dot. So one thing you might ask is the pain is felt by nerve, so those myofascial pain also neurogenic? The answer is half and half, because the pain distribution, which was represented with red dot, also means sensory nerve distribution caused by entrapment by triggered muscles. But usually the neurogenic pain is very different from the myofascial pain, which caused by trigger point. Usually it has dermatome, which means distribution of stinging or burning pain along nerve pathway. This picture showed variety of dermatome, and for example, for patients with herniated disc, the inflammation of the nerve root can present neurogenic pain to its pathway. So we've learned that there are two types of pain, neurogenic and myogenic, and actually there are more, and anyone can guess that we can treat different pain with different approach. So knowing the feature of pain is imperative for optimal treatment. In this video, my focus is on physical therapy to myofascial pain patients. This is the information of the patient I had treated for 6 months and got better and returned to no pain life. He was in his desk job for 10 years and his pain distribution is on trapezius, deltoid and rhomboid area. He has no sign of neurogenic pain such as stinging or burning sensation. He also represents no swelling sign. He also received prolotherapy, hydrodissection of nerve decompression, and nutrition support. But can you guess what physical therapy he received and how we do that in everyday life? I will show you the answer first. He received stretching manual therapy to his posterior neck along splenius and semispinalis capitis, but his pain stays in trapezius. So he got everyday trapezius active stretching exercise education and his pain was gone. Before I show you how to stretch, I will tell you the details about posterior neck pain. Let's look at this MRI image. Usually due to degeneration, many components can cause posterior neck pain, especially due to disc degeneration. Facet joint degeneration that connects two cervical vertebrae together can also cause posterior degenerative neck pain. And also, lucica joint that stabilize left and right balance of the cervical vertebra, which is called coronal balance of head, can also cause posterior neck pain. Along with this pain provocation structure, due to desk lifestyle and increased use of mobile phone, the head protrudes forward, which is so-called turtleneck, and also posterior ligament and muscles are stretched and become tense. The ligament and joint capsule is so-called static stabilizer that prevent neck hyperflexion, which means over movement of head to the front. The dynamic stabilizer also protects the neck, but also makes movement, which is the function of muscle. Among this dynamic stabilizer, Semispinalis capitis is very important for this dynamic stabilization, and weakness of Semispinalis capitis can trigger muscle tense to splenius muscle, which is shown in this photo, and loss of cervical lordosis, and that can cause turtleneck. Also, many turtleneck patients suffer from headache too. This problem is quite complicated, but mostly the problem belongs to posterior ligament that connect C1 and C2 vertebra and deep posterior muscle group, which forms suboccipital triangle. Many nerves as shown in this photo, such as greater occipital, third occipital, or lesser occipital, and great auricular, these many nerves that innervate head can be triggered and inflamed by these muscles. So, based on this medical knowledge, we can treat our own pain by learning how to do physical therapy. If you want to release your posterior neck, you should start with splenius capitis muscle by rolling down your finger from occipital bone to the scapular level. It starts from posterior ear, posterior to the mastoid process, and reaches C7 spinous process, the most prominent spine that can be touched yourself. After massaging it for 3 or 5 minutes, you should follow the order. You should go to Semispinalis muscle. Also, to correct cervical alignment, scapular alignment is important. Usually, turtleneck patients have their scapula abduction plus downward rotation. This movement causes thoracic flexion and turtleneck. You can demonstrate yourself that if you make your scapula see upward, your cervical vertebra aligns automatically by its normal lordotic curvature. So the scapular alignment enhancement training is important, and the target is trapezius and rhomboid. As you can see in this photo, stretch elastic bandage to the front and make sure not to move on your arm, but imagine to put your two scapula together. That way, you can absolutely release your scapula and rhomboid pain. This is Global Standard Pain Management YouTube channel, so if you want to learn more, wait for my next video. Thank you very much for watching.